Hello, welcome to week 32 of your twin pregnancy. At this point, I am sure you're exhausted between the insomnia, the leg cramps, the shortness of breath, and two tiny humans wiggling around in your uterus. It's been a while since you've had a good night of sleep. You are also having a lot more pelvic pressure, lower back pain, swelling in your hands and your feet. You may be noticing your breasts are leaking and your skin is really itchy, especially around those stretch marks. That being said, it is not okay for you to have itching on the palms of your hands and the soles of your feet, especially in the absence of any skin changes. It's also not okay for you to have preterm labor symptoms, 5 or more cramps in an hour, water running down your leg that isn't urine, bleeding enough to saturate a pad. You should be feeling your babies moving every single day. In the third trimester, we are on the lookout for preeclampsia. Women with preeclampsia have very high blood pressure. You are not watching your blood pressure all day, every day, so symptoms for you to be aware of. The worst headache of your life won't go away no matter what you do. Changes in your vision, black spots, flashing lights, tunnel vision that occur at rest. A burning sensation in your liver. Your liver is located behind your right breast. Finally, it is not okay for you to have worsening depression or anxiety symptoms. If any of these are bothering you, please let your provider know right away. So at 32 weeks, what are your little ones up to? Their sleep-wake cycles are becoming much better defined, and their bones are definitely getting harder, which is why those kicks are getting so strong. If you are having a little boy, this week his testicles are going to descend into his scrotum. If you're carrying a little girl, she now has her lifetime supply of eggs in her ovaries. So technically, in addition to carrying your daughter, you are carrying the eggs that are going to create all of your grandchildren, which is actually kind of cool. So what's going on with you? At 32 weeks, you are most likely being seen every other week. At that visit, they are checking your weight. Average weight gain at this point is about 1.5 pounds to 2 pounds a week. You're also monitoring your blood pressure closely. Most likely you are scheduled for an ultrasound coming up here pretty soon. They're going to want to check the baby's weights. Normal weight at this point is right around 3.7 pounds or 1.7 kilos. That is an average. Some babies will be bigger than that and some will be smaller. Most likely one baby is going to be a little bit bigger than the other. As long as there's less than a 15 to 20% discrepancy between their weights, it is completely normal. They're going to want to check the baby's heart rate. Normal range at this point is 110 to 160 beats per minute. Finally, they're going to want to see what position your little ones are in. Ideally, baby A, the baby closest to your cervix, is in the head down position. Typically at 32 weeks in a twin pregnancy, whatever position your babies are in now is the position they will stay in for the remainder of your pregnancy. So what should you be doing? I encourage you to continue following a good, healthy diet. Remember, because you are growing twins, you do need an additional 900 calories every single day. Make sure you're drinking tons of water. If you are thirsty or your urine is dark in color, you are dehydrated. I recommend you continue taking your prenatal vitamin, your low-dose aspirin, and any other supplement or medication that your provider has recommended you take as directed. If possible, I encourage you to try to stay active with low-impact exercises such as prenatal yoga or swimming, as long as it's okay with your provider. Now is also a good time for you to find a pediatrician and to schedule a tour of your birth center. If you are still working, I encourage you to talk to your employer about your upcoming maternity leave, and if possible, if you can cut back your hours for the last couple of months of your pregnancy. We no longer routinely recommend complete bed rest in the third trimester due to your increased risk for blood clots. However, if you can cut back on your activity, that would be nice. You definitely want to start thinking about how you plan to feed your babies, who's going to help you after you deliver, and how do you plan to prevent pregnancy going forward. Finally, you are going to want to talk to your provider about the plans for your upcoming delivery. I hope that you're writing down your questions in anticipation of your next visit. In the meantime, if there's any questions that I can answer, please feel free to drop those in the comment section below. While you're in that comment section, I would sure appreciate it if you'd hit that like button.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from that information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.